Welcome to the video training program of InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We're excited to show you everything InTouch EMR can do to streamline your practice. So let's get started.
Hi everybody, this is Nitin Chhoda with InTouchEMR.com and InTouchBillerPro.com, and in this video training I'm going to talk to you about the emphasis of Obamacare or the Affordable Health Care Act on accountable care organizations. Now, in an effort to lower the costs of healthcare, Obamacare has a pilot program with accountable care organizations, also known as ACOs, which, if it were to become standard, can actually change the way reimbursement and healthcare is delivered and can have a significant impact on private practice owners. Now, an accountable care organization is essentially a team of healthcare providers that work collectively to provide a range of services to the patient and lower healthcare costs. Now, here's the thing. Any savings that accountable care organizations create for the federal government, because they're able to, according to the government, lower costs and get patients better faster, they are going to be able to either get a part of those savings or they'll be able to get financial incentives for getting patients better faster. Now, this has the potential to lower quality of care, because what this can potentially do is, have patients literally be thrown into a system, get treatment quickly so that they can be sent back, because this has the impact to actually affect private practice owners. And if this does indeed become standard, private practice owners will have no choice but to become a part of accountable care organizations in an effort to continue working with patients, or seek other avenues of income like cash pay programs and becoming a concierge practice. We'll be talking about a concierge practice in another video training. The accountable care organization is basically, as you may or may not know, a multidisciplinary team that consists of hospitals, clinicians, and home healthcare providers that are charged with the responsibility of getting patients better as quickly as possible. Services are bundled and a flat fee is paid to the team. Now, what accountable care organizations attempt to do is to reduce expenses, get patients better faster by reducing so-called unnecessary tests and procedures and less use of expensive technologies. Now, like I said earlier, accountable care organizations that get patients better faster will be getting financial incentives and rewards from the federal government. And in fact, like I said, if this becomes standard, Medicare patients will actually be going to accountable care organizations and continuing to see them for up to 30 days post-discharge, which has the potential to significantly impact private practice owners. We don't know if that's going to happen yet as of the time of filming this video training, but if that does indeed happen, private practices need to adapt and need to diversify very, very quickly. At the end of the pilot program with the accountable care organizations that the government has, the information will be that is gathered through accountable care organizations. A lot of it actually has to do with outcomes and the expenses that are incurred by the government towards the treatment rendered by the ACOs. All of that information will be evaluated, and the government, specifically the IPAB, the Independent Payment Advisory Board, will try and evaluate where a potential for cost savings exists. So keep in mind, the idea here from the government is to find ways to lower costs. Will that impact quality of care? Will that actually impact private practice owners and force them to become a part of ACOs? It's too early to tell, but it's a real threat. And as a private practice owner, you, like I said, need to diversify, need to be looking into other cash paying programs and potentially becoming a concierge service, which, like I said, we'll cover in a separate video training. The data will be examined by the Patient Outcome Research Institute, the Patient Outcomes Research Institute that's been created by Obamacare, and the IPAB, which is the Independent Payment Advisory Board. Like I said, if this becomes standard, it'll have a big impact for private practice owners, and it's conceivable that private practice owners may be forced to become a part of accountable care organizations. It's important for you to be aware of this and start thinking ahead, start adapting accordingly. I hope this video training was beneficial, and I wish you all the best. And we here at InTouchEMR.com and InTouchBillerPro.com are here to provide you with affordable EMR and billing software technology so that you can stay one step ahead, remain efficient, and be able to compete in the Obamacare economy that may see an emergence of ACOs and accountable care organizations. That's just a fact. That's the reality of the world we live in. We have to be prepared and think one step ahead, and we are here to help you do that. Thank you so much for watching.
Thanks for watching this video training from InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We'll see you in the next training module.